ADs right the way through to our elderly populations. I take a lead on adult vaccinations because that's my background. I worked in critical care for an awful long time before moving into education and workforce roles within the health service. And then had a bit of a curveball and a bit of a change, and I've now ended up in vaccinations. So that's just a little bit about me. So I will share my presentation with you, and hopefully you will be able to see that, and you'll all disappear from my screen now. So Chloe, can you just let me know if that's sharing?
Yep, good to go.
Excellent, perfect. So my job title is assistant locality leader. It doesn't mean anything to me, let alone to most other people, so don't take too much notice of that. But I do work with a vaccinations programme team, so we are a dedicated team of people within the ICB that work on vaccinations. So what we're going to look at today, this is what I've been asked by Chloe and Mark to talk to you about. So an overview of the benefits of immunising care home staff and residents, some processes for implementing a vaccination programme across our care homes in Lincolnshire, some actions that are required by care home staff to do, and just to share with you some key contacts and resources around vaccinations. So hopefully that's what you were all expecting me to do. So I wanted to start with this, which is from the World Health Organization, which just gives us an overview of how important immunisations and vaccinations are. They are key to our primary health care. The WHO describe it as an indisputable human right. It is one of the best investments money can buy in terms of public health, and secondary only to hand hygiene is the most effective way of stopping some of those infectious disease outbreaks across the world, really. So that's why it is so important that we pinpoint vaccinations, and why I seem to spend my life just banging on about them, which is fine because I love it. So why are vaccinations important in care homes? Why do we need to even think about making sure our care home residents are vaccinated for some of these diseases? So we accept and recognise that those that are in care homes and those that work in care homes are at higher risk of infection and severe illness from some of the diseases and viruses that we vaccinate against. So most care home residents are by their very nature older adults and or people who live with long-term health conditions, so therefore are more vulnerable and susceptible to developing serious complications from these diseases, and particularly when we talk about flu and COVID and pneumonia as we're coming into the winter season and that respiratory virus season. They live in close quarters with each other. They have shared spaces, a little bit like schools, which is why we target our children as well, because they spend a lot of time in small spaces with other people within their cohort of individuals. So infections do spread quite easily and very, very quickly in those environments. I'm sure some of you on the call will be well aware, once an outbreak starts, it's really difficult to get that under control in a care home setting compared with if we were out in the general community. So we want to protect our care home staff and our visitors as well as our residents. So vaccinating reduces the risk of staff passing these infections on to residents and vice versa, which helps maintain staffing levels for you guys in the home and preventing sickness within your workforce, which is really important for making sure we're looking after our residents properly. So it also prevents outbreaks and reduces hospitalisation rates. So outbreaks in care homes can quickly overwhelm local hospitals due to the number of people that might require urgent care and urgent treatment in quite a short space of time. If something's spread through a home relatively quickly, it can put real pressure on those GP services and hospital A&E services particularly. So overall, it reduces the strain on health services and possibly, hopefully, lowers admission, which is not only better from a financial perspective or better for the hospital, it's better for your residents as well. You know, none of us want to be in hospital. It's not a nice place to be. So it is important for maintaining the quality of life. So preventing these outbreaks reduces the need for some of those strict restrictions you might need to put on, where, you know, visitor bans, for example, where residents can't get visitors or they can't stay socially connected because they need to be isolated in their rooms. It's not great for them. So in short, really, vaccination in care homes is about protection, it's about prevention, and it's about preserving independence for some of those really vulnerable people in our communities. So just because I do a lot of talking, just a little exercise. There's no right or wrong answers. I just want you just to pop in the chat some of the vaccines that you think your residents should be offered. I'll just come off sharing full screen so I can see the chat. Just pop some vaccines in there that you think your residents might be eligible for. Anybody brave enough to go first? Yeah, flu, COVID, pneumonia. Yeah, excellent. Those are the ones that we think of, particularly Charlotte at this time of year, in terms of winter. Yeah, shingles. I'm not sure who that is from Seacroft, but Deborah, you've popped shingles as well. Absolutely. And shingles is often one that doesn't necessarily get remembered. But there is one more that you've not mentioned. So let me just pop back onto full screen and I'll go through them all for you. Shingles, absolutely. RSV, PPV, absolutely. Flu and COVID, absolutely. But there is a new vaccine that was brought out last year to protect against RSV, which is another respiratory illness that your residents should have had an offer from their GP to be vaccinated against RSV as well. But I'm going to go through each of these in a bit more detail for you. So if we start with shingles, so shingles comes from the herpes zoster virus, the varicella zoster virus, which is the same virus that causes chickenpox. So often we get chickenpox as children, and it sort of lies dormant in our bodies for a long time, and years later it can reactivate, as it were, leading to shingles. Shingles is very, very painful. If any of you have had shingles, it is incredibly painful. It causes a burning and tingling sensation on your skin that often comes before the rash appears. When you have cold sores, which you often get in the corners of your mouth, that's the same sort of virus, and you get that tingling before anything sort of surfaces to the skin, so you kind of know it's coming. And it's not pleasant. So the red rash that comes often develops a few days after that tingling, and you can see there's a lovely picture I'll put on there for you of the fluid-filled blisters that appear on the skin when somebody contracts shingles. These do eventually scab over, leaving really itchy, really sensitive skin to touch, and that can last up to 4 weeks, that rash. It's really not very pleasant at all. Can also give people fever, headache, make you extremely tired. Those are less common, but probably more common in the elderly than in our younger population. And it's the pain really that is the worst side effect of shingles. Severe pain, which is called post-herpetic neuralgia. Some of you might have heard that, and that is more common in older adults, and it can last for months and months and months and months, and is very, very difficult to get on top of. It needs really strong painkillers, and often they don't work particularly well, so it's something we really want to avoid. Can lead to sight and hearing problems. It can make you blind, it can make you deaf, and it can be fatal. It's rare that it's fatal, but shingles can be fatal. About 1 in 1,000 cases of shingles can end up in death, which is really quite frightening. So we offer a shingles vaccine. And that vaccine is available to anybody that is aged 70 plus or 65, 66, and some people who are 67. Now I say it like that because shingles has the most horrendous schedule attached to it, and I'm not going to dwell on it because it is not up to you guys to decide whether your residents are eligible for shingles. That's down to GP and the healthcare workers, but it just gives you a bit of an idea. Particularly those of your residents that are in their 70s are eligible for a shingles vaccine. It is a 2-dose schedule now. It is not a live vaccine that's given anymore, but it is given in 2 doses, and those are given 6 months apart usually by the GP. So that's a bit of an overview on shingles, and I think PPV is next. So PPV, which is pneumococcal polysaccharide vaccination. I'm not repeating that because Latin was never my strong point. And that protects against Streptococcus pneumoniae bacteria, which causes a number of particularly respiratory conditions. Mainly in the elderly, it's pneumonia. and this is often referred to as the pneumonia jab by lots of people as well. But it does also protect against meningitis, septicemia, ear and sinus infections, anything really that's caused by the Streptococcus pneumoniae bacteria. So it can be life-threatening, these infections, especially for older adults and anyone with chronic health conditions, and often older adults do come with chronic health conditions as well. So it's really important that they get the PPV vaccination. It's one dose administered over a lifetime. Most people don't need a repeat dose, and it's offered to everybody over the age of 65. So pretty much everyone in your older adult care homes will be eligible for a PPV vaccine. So yeah, it's one that should be easy to get on top of uptake, because it's once in a lifetime and it's done, and you're always marked as having had it done. But actually uptake of it is not where we want it to be, particularly in Lincolnshire. RSV, so this is the new vaccine that came out in September last year, so just over a year this has been given. RSV has traditionally been linked to young infants. You may well have heard of that if you've got small children in your families. It's often what fills the paediatric wards at winter with really poorly children with bronchiolitis and severe respiratory distress. But it is also prevalent in our older population, and historically we haven't tested for RSV in adults in this country. So there is a school of thought that there are probably a lot more cases of RSV out there that are treated as respiratory conditions in hospital because we've not specifically tested for RSV. So there is an expectation that the vaccine programme will have an effect on the number of adults that are requiring hospitalisation this year. There was some research done, I believe it was in America, but it could be Australia. My brain's not quite tuned into that at this point in time, where there was a 30% reduction in hospital stay in those that have had an RSV vaccination. So there is an expectation that this is going to have a real impact. But as with everything, time will tell. So RSV is respiratory syncytial virus. That's what it stands for. Much easier to say RSV. And everybody is offered this that's aged between 75 and 79. At the moment, there is talk of changing that cohort, but at the moment it's just been offered to those in their mid to late 70s, and it's one dose administered either by the GP teams, and we do have a central vaccination team that have been doing some work on these vaccinations for us as well in Lincolnshire. So some of you may well have seen a team from LCHS coming in administering RSV vaccinations in your residence. So that's just a quick whistle stop of RSV. And then we move on to, I had to throw this slide in there because we've done a lot of comms in the ICB around winter vaccines. So I'm just giving a bit of a build up to you for our known winter vaccines, because winter is coming, as Chloe rightly said. The adult vaccination programme start on the 1st of October, which is really not very far away. And that's for COVID and for flu. So flu, a lot of you will be familiar with. Flu circulates annually. It's an incredibly contagious respiratory illness, which is usually caused by influenza A or B virus. There are others out there, but for the most part it's influenza A and influenza B, and those are the ones that we tend to be vaccinated against. It infects the nose, throat, and sometimes the lungs, and again particularly those that are very elderly, those that are very young, those that have chronic health conditions are more susceptible to getting serious complications from flu. I didn't roll off the tongue very easily. So it spreads through droplets when an infected person coughs, sneezes or talks, or breathes, quite frankly. Little droplets of it come out in the moist air that is expelled from our faces and lands on surfaces, and it doesn't get instantly killed on those surfaces. Someone else will come along, touch it and inadvertently touch their face, and lo and behold, they've contracted flu from somebody really unwittingly spreading it. So it is really important that we get on top of flu, and there's a real push on flu vaccines this year, much more so than COVID. We are expecting a heavy flu season and a busy flu season this year. So flu can be mild if most of us get flu. It's if you're fit and healthy, it's not really that serious. It'll wipe you out. Proper flu will make you bedbound. It will make you feel dreadful, but you'll get over it in a few days, and it won't really generally lead to many serious complications. But it can do, and like I said, particularly those that are very elderly, those that have worsening chronic conditions, severe asthma, heart disease, lung disease, COPD, etc. It can lead to pneumonia and bronchitis, which, you know, you'll know those conditions are very serious, often lead to hospitalisation. And just some statistics for you on this slide as well. So between the 2 years of 2022 and 2024, there were at least 18,000 deaths in England attributed to flu. That's a lot of people dying from flu. It does on average, it averages about, most years it's about 10,000 excess deaths because of flu every year. So it's a lot of people this is affecting. And when we talk about hospital admissions, particularly through COVID, you'll have heard we need to protect the NHS. We need to make sure our hospital services can run smoothly. So if we can try and release some of that pressure, you know, that benefits all of us, not just those that are presenting with flu-type symptoms. And last winter, at one point in time, there were over 5,000 patients in hospital with flu, and that was just at a given point in time. That's not throughout the whole season. That was just one day. Across England, so it's a lot of people get hospitalised with flu. So just to run over some symptoms of flu, so you're aware, sudden fever or chills or both, cough, cold, sore throat symptoms, runny, stuffy noses, extreme tiredness, and body aches, usually to the point where you can't get out of bed. If you're just feeling a little bit rough, it's probably more likely you've got a common cold than flu. Flu will give you extreme tiredness. It can give you headaches and it can cause vomiting and diarrhea, but that generally tends to be in the young rather than the elderly, but certainly not exclusively too. So flu vaccinations are given once a year. You will all be well aware, I'm sure, and they're administered usually by a community pharmacy team, a GP primary care team, or our central vaccination team will come to your homes to offer flu vaccines. And I've just added a little snippet on here around the vaccine, that it is an inactivated vaccine. It's dead. Any viruses in it have been killed, so it cannot cause whoever's having that vaccine to contract flu, because there is no flu live virus in the vaccine. So I just want to kind of hammer and labour home that point really. So COVID vaccination helps protect us from getting seriously ill and being administered to hospital or dying from COVID-19. And in the UK, we vaccinate twice a year. We have 2 programmes, one in the spring and one in the autumn. The reason we have 2 programmes for COVID and not for flu is because the COVID vaccination does not last as long as the flu vaccination. It does not mean we don't get flu over the summer. We do, and we did see quite a bit of it over this summer. It's just that the vaccinations for COVID, the immunity doesn't last as long as the flu vaccine, which is why we offer it twice a year. So the symptoms from COVID can vary. I mean, I'm sure you'll all remember from the pandemic that list of symptoms changing every 5 minutes, and it's no different now really. They can range from very, very mild to you not even knowing you've got COVID, to really quite severe. And particularly, again, like any of these conditions, it is the very elderly, the very young, those with worsening and additional health concerns that are more susceptible to getting severe illness from COVID. Children can still contract COVID-19, but often have much milder symptoms, if any. So at the moment, we're not offering a vaccination programme routinely to children like we do with flu. If a child is immunosuppressed, they can still get a COVID vaccine, but they are very, very few and far between, particularly in Lincolnshire. So I've just wanted to add on here as well about the testing. So COVID-19 vaccines have undergone rigorous testing and continue to be under the sort of strict safety monitoring that any other vaccine you would expect. But you still do see some side effects, as you do from every vaccine really. You can get a sore arm, you can feel a bit tired, and you can get a bit of a mild fever. That is a normal immune response to vaccines. It's your body doing what it should be doing, if you like. There are serious side effects that have been reported, but they are extremely rare from a COVID vaccination. So these are administered again by your GP. Some of you have primary care networks, vaccination teams that will come out and vaccinate for COVID. Some have community pharmacy teams and some have central vaccination teams. So there's a bit of a mix that offer COVID. And it's all residents in care homes that are in an adult registered care home are eligible for a COVID vaccine. And just a little bit of assurance for you on there that any homes that are not registered for an over 65 or an adult care home, those residents are checked for eligibility. So if they're immunosuppressed, they will still be visited and offered a vaccine. So I just wanted to put the detail on both slides, both vaccines, sorry, on one slide for you. So because the eligibility is different. So flu is nice and simple. If you're in a long stay residential or a care home, you're eligible for a flu vaccine. COVID is slightly different. If you are in a CQC registered care home for older adults, that's your over 65s, you are eligible. Every resident in that home is eligible irrespective of their age. So they may be under 75, because they're in a CQC registered care home that is registered for over 65s, they can still receive the vaccine. And just a little bit of an explanation, the next point down is those homes that are not older adult care homes, so learning disabilities, mental health homes, those that fit the usual criteria for a COVID vaccine. So if you're over 75 or you're immunosuppressed, you can receive a COVID vaccine. And the immunosuppressed list is not the same as it was. It's not the same as an at-risk. You have to be immunosuppressed and on medication for that immunosuppression. So it's a much smaller cohort than it used to be. And I've just put a little note on here as well. The idea this year is that we will complete COVID and flu vaccines in care homes by the 12th of December. Most will be done way before then. I will add that the 12th of December is sort of an absolute deadline, so we're not heading into Christmas and still having some care homes that require vaccinating. Our teams are very good in Lincolnshire. We're very lucky. We tend to be one of the first counties in our region that finish our care homes, particularly for COVID. So I don't see any reason why this year won't be the same. Now, the next slide, I want to show you a little video, but in true to form, I didn't do what I needed to do when I initially shared this, which was to turn on the sound. So I'm just going to reshare it, and hopefully you will be able to get the sound for this little video. So this is an animation that we've put together in the ICB based around, if I can actually open it. Bear with, I'll keep talking to you because I've got it on here. Based around different cohorts. So hopefully, if there's no sound immediately, Chloe, will you let me know?
Flu season is coming. Get your best defence this winter. Flu is unpleasant. It can cause aches, a high temperature, a dry cough, sore throat, headache, and extreme tiredness. Serious complications of flu include bronchitis and pneumonia. It can worsen existing heart and respiratory conditions and can be fatal in the very frail and vulnerable. The vaccine will help protect you against flu. It will reduce the chance of others around you, such as your friends, family, and those with long-term health conditions getting flu from you. The vaccine is safe and cannot give you flu because the viruses in it are inactivated, meaning they cannot replicate or cause infection. After the vaccine, you may experience side effects such as a mild fever, headache, and sore arm. These are all quite normal. If it is safe to do so, it is recommended that you take paracetamol and drink plenty of water. Consider which other vaccines you may be eligible for, including COVID-19, PPV, shingles, and RSV. If you're unsure which vaccines you're eligible for, you can discuss this with your GP practice. Community immunity plays a vital part in reducing the spread of flu. Protect yourself and your friends and family by getting vaccinated and encouraging them to do the same. If you're eligible, you will be invited by your GP, or you can make an appointment with your local pharmacy, or visit the Grab a Jab page for more information.
That was great.
They're fab, and there are a few that we've done actually, so they will all be shared with you. Let me just go back to my presentation. That was the lovely Charlotte from our ICB comms team who narrated the video. And then where's my slides? There they are. Right, I'm back in the room. That's technology makes things so easy but so complicated as well. Okay, so that's a little bit around your residents. So your staff, which I know a lot of you are interested in as well. So care home staff are eligible for a flu vaccination this winter. They are not eligible for a COVID vaccination. So there will be no routine offer for COVID vaccinations for staff. If they happen to fit into the immunosuppressed criteria, or if you happen to have any staff that are over 75, they are eligible through that route for a vaccine, but not just because they're a health and social care worker. It's a seasonal vaccine, you know this, it's given once a year and administered by local pharmacies, our central vaccination team or our GP teams. Now, there is a booking system for flu, which is the national booking system, and I do have a link on our final slide for that. And the QR code on the poster you can see there will take you to our Lincolnshire Grab a Jab page, which also has a link to the national booking system on it. So those are the different routes for your staff to access a flu vaccine. If the GP team comes into the care home, they will be able to offer your staff a vaccine. If it's the central vaccination team that come in to vaccinate your residents, they will also offer your staff a vaccine. If that's not convenient for your staff, they can go to any local pharmacy and book in through the national booking system. There will also be some drop-in clinics, which we're in the process of arranging with Lincolnshire County Council. We did something similar last year where the central vaccination team put on a drop-in clinic in I think 10 of the different county council offices around Lincolnshire. So care home staff and domiciliary care staff as well will be able to access a vaccine that way. So it's a slightly different setup to how those that sort of work in an NHS trust get their vaccine, and that's because you don't have an occupational health offer that delivers a vaccination programme for you. So if I talk a little bit about consent, so we're going to go back to residents here. Would hope all of your staff have the ability to consent. So the consent process for winter vaccinations should have started really already. Some of you may well have had contact with your GP practices or the central vaccination team if they're coming in to do your homes. It's really important that that's done alongside residents and family member or representatives of the resident if it's needed. Consent is standard NHS practice and it is a legal requirement for everything we do as healthcare professionals. And we have to ensure that our patients have informed consent and they understand what we're doing and why we're doing it. So where individuals have capacity, consent does not have to be written and it can be verbal. So that's almost a move away from, if any of you remember through COVID, we had to have a written consent form for every resident. It's no different to if you or I were to walk into a GP practice or a pharmacy. We don't have to sign a written consent form. If you have a capacity, verbal consent is absolutely fine. And it is crucial that any consent or refusal is documented by the clinical team, and you make sure within your care home you've got the notes that you need to keep for these processes in line with your local policies as well. So if a resident is assessed as not having capacity, then they ideally should have an LPOA, which is the lasting power of attorney for health, not for finance. It needs to be for health. And this should be checked in line with your local policies, and that you should be keeping details of who those LPOAs are for your residents, because obviously you won't just use these for vaccinations, it'll be for anything you do with those residents. Care home staff cannot consent on behalf of residents. Likewise, they cannot decline on behalf of a resident either. The immunisation, if we go back to what I spoke about how the World Health Organization portrayed this, it is a human right, and we have in this country the ability to make those decisions, and the LPOA and the best interest process is in line and is set in statute for those that don't have capacity. So it's really important that legal framework is followed by yourselves and by clinicians. GPs are well used to doing this, and they will know your residents as well. So it's not something that we're asking to be done that they're certainly not trained or capable of doing. So where it's established that a resident lacks capacity and they have no lasting power of attorney for health in place, then the clinician will do what's called a best interest decision. Now, that is usually done in line with potentially family of an individual. They will discuss probably with yourselves in the care home to get an idea of that individual. They will also look at that individual's history with vaccination. So if somebody has always declined a flu vaccine for the last 20 years, even when they had capacity, the likelihood is that individual would not consent for a flu vaccine now. So they will be pragmatic and use that information, albeit most health professionals, I would think, would say actually it is in your best interest to have a flu vaccine. But on likelihood, I've discovered that this patient or this resident probably wouldn't want one, then they will use that in their decision-making power. So they won't ignore what patients have accepted or not accepted and consented for in the past. So these processes do take a little bit longer, obviously, than those that can consent to it. It is really important that those discussions are started sooner rather than later. I had one incident a couple of years ago. I don't think it was from a home that's on the call, where we had one gentleman who did not have a lasting power of attorney for health. He did not have any living relatives. He did not have capacity. And there was a legal representative involved in his care. And it took weeks and weeks and weeks to get a best interest decision done for this gentleman, and he didn't receive his COVID vaccine until well into the January of that year. It took far too long. It left him at risk, and this was back during the pandemic when COVID was quite prevalent, so he really was at risk, and we don't want to go back to scenarios like that. So it is really important, those conversations for those residents who don't have capacity and are, particularly have family and friends around, that we start those conversations before, so that clinicians can get that Mental Capacity Act and best interest documentation all in order, ready to be vaccinated. There are some consent forms available still. The NHSE have left those available. There's a link there onto the website, but they've not been updated. They can be adapted locally if that's what people like to do, and some GP practices do like to do that, so you may well see them, but they're certainly not enforced anymore by NHSE. So, but they're there if we want them. So thinking about patients who don't necessarily have capacity, this is if any of you know me, which probably most of you on this call don't actually, but I love anything with a bit of colour, so I've used this up, make it look all fancy for you. But this is developed by the Royal College of Psychiatrists, following a piece of work that was done around vaccinating those with dementia. And feel free to take this and print it off and share it as you wish. The reference is in the link there on the bottom, and it's just a really good reminder. I think for some people find vaccinations really quite difficult, and because you've got dementia, it doesn't mean that you're not going to find it quite difficult. So visual aids can be helpful. Make sure that you've assessed capacity correctly, communicate with the individual, choose your moment. Sometimes straight after breakfast is not a good idea, or mid-afternoon when they want to have a nap. Let's just pick a time that suits them. They are individuals. Let's individualize what we're doing with them. Never rush. And I do know that when you're doing a big flu clinic in a care home, there probably is a tendency for clinicians to rush a little bit, but this is just a bit of a reminder. Actually make this appropriate for the residents and the patients that we've got in front of us, and engage with family and friends. Your residents, which ones potentially might find this experience trickier than others. Would it help to have a family or a friend member there with them? Would that might make this process a bit easier, and if that's something that can facilitate it, let's do it. So feel free to take that and use that one far and wide. So this is a flowchart that I've pulled together. Over the last few years, what I found was the care homes that we had difficulty with ensuring the vaccination happened in a structured and sound and a safe way often came because the care home staff and I won't just say GP because it's not just a GP, so the team, the clinical team that are coming in to vaccinate the residents in that home didn't plan together. And I have on quite a few occasions, had conversations with clinicians that, I think I might go and do that home tomorrow. No, if the home don't know you're coming tomorrow, don't just rock up. That's not good practice. I'm allowed to make a GP appointment for my vaccines for when it suits me, because I'm able to do that. Just because I'm in a care home or a residential home doesn't mean that should just be done to me, as opposed to me having some say on when I have these things done. So it's a bit of a compromise between the two. So what I'm really pushing for is for both teams to actually communicate and plan these visits. When we've done that in the homes, that they've run so smoothly, and the feedback we've had is really been great from those. So that communication between the care home and the provider is absolutely vital. You both need to plan. You both have things on that you need to plan. So actually you both need to know what's going on. So liaise with that care home to arrange a visit. Avoiding meal times is the advice I've given to all providers. Don't rock up at lunchtime, because you guys are busy, your residents are busy. You've probably not got a space available because you're using your rooms for dietary needs, etc., etc. And my history is working in a hospital. We had protected meal times for a reason. I don't go to my GP practice and take my packed lunch with me. I eat before I go, and just because the clinical team is coming to you, it shouldn't be any different. And some homes will have days and times when it's just not suitable for a vaccination clinic to run. Some of the other comments that we've had in the past are around, we turned up but half the residents weren't there. Well, that's because they didn't know you were coming, because they'd taken them out shopping or something for that day. So, it is so important that you plan together. So ensure that there is a named member of staff from the care home that's aware of the details of the visit and when that visit's happening on the day. That's really important as well. Visit requirements should be explained prior to the visit. The clinical team should have told you what they need. That saves rushing around at the last minute, and working together. That's the point I'm trying to bang home with this one, really, and particularly around consent prior to the visit is really, really important. Plans and progress is shared with me in the ICB programme team. I have regular meetings throughout winter, once a week usually, with the clinical teams, and I do badger them. When are you going? How many did you do? Have you got to go back? Is that home finished? That all happens behind the scenes. You won't see that, but I just wanted to assure you that does happen. And a slight change this year is that ULTH and LPFT will be offering flu vaccinations to inpatients prior to discharge. That will be those patients that have been in hospital over 21 days and those that are coming out to a care home. So you may well start to see some admissions into your homes. If they're coming from hospital, they may well have already had their flu vaccine, which hopefully will have a good impact. So actions for care homes. So this is a little bit more around what our ask of you would be, really, and our advice to you to make this stuff run smoother. So on your MDT meetings, make it a standing item to check vaccination status on admission. Once you're in the throes of doing that with your primary care colleagues, it will just become second nature. Do you have a vaccine champion within your care home? If not, they really can help all of this work a lot smoother. And is it possible to involve the residents in the planning of these visits? It's their home at the end of the day, isn't it? Consider consent and capacity. I think I've probably banged on about that one enough. But can your residents attend a GP, surgery or pharmacy? They do have that as an option. They don't have to wait for the GP practice to come out to them. If they want, you might have somebody whose family member is really keen to get them a flu vaccine early on in the programme. If they're quite happy and the resident is quite happy, make an appointment at a pharmacy and take them there. That's absolutely fine. The visits to care homes are done en masse, but individuals, they have a choice. They have a choice to go where they want to. If they have capacity, they can do that if they want to. No reason why you can't take them as well if that's what they wanted and you were able to do that. Care home and vaccination plans, teams to plan together prior to the visits and make sure the time of day suits the residents. And again, on the day, if you can have a dedicated staff member who's available, who knows the team are coming and knows where they're going to set up and knows the residents, it really does make those sessions work much better for the care home staff and the residents alike. You will all know about the care home tracker, so just a plea from me to complete the care home tracker. I will add the caveat as best you can, because I do know that you don't always know which of your staff members have been vaccinated. It's not a perfect system, but it is the system we have at the moment. So if you could complete it, particularly for your residents and for the numbers of staff, you know, that is really appreciated. We do look at it in the ICB, and I know the County Council do look at it and use it as well. And the next two are around comms and information, really. Share the vaccination communications within the care home. Have your posters up so residents can see it, so they know there's a team coming, or they can ask questions, and share the information with your staff in staff meetings and your communications, whether you have newsletters or Facebook pages or intranets, etc. Just to make them aware. And I know Lincoln are very keen on doing all this as well. So I'm nearly done, you'll be glad to know. I wanted to give you just a little bit of an overview of what's been happening in Lincolnshire and what's going to be happening in Lincolnshire. So a Lincoln representation is usually Mark. Do come and sit and participate in our seasonal vaccination working group. That sits every 2 weeks usually, and it now runs all year round. Because the vaccinations might only happen over 2 or 3 months of the year, but believe you me, there's an awful lot of planning that is involved in that. So we do talk about it all year round, and Lincoln have become very involved in that process, which is great. We're exploring the possibility of care home staff delivering flu vaccines under a peer-to-peer arrangement for next winter. I say exploring, it's very, very complex. But it is something that we're keen to have a conversation around how that might work. So we just wanted to sort of get that out there so you all knew those conversations were starting to happen. The care home, you guys yourselves fed into our seasonal senior leaders workforce vaccination service, a bit of a mouthful. And we had a lot of responses from care home managers. So for those of you that did fill it in, thank you. Your recommendations really were used when we've developed some of the comms for this winter, and particularly around myth busting, which I will share all of that with you around staff viewpoints on vaccinations as well. So we have robust assurance I mentioned around COVID vaccines in care homes. That's something that's happened since the COVID vaccination programme's been in place. What we haven't historically had in the ICB is the same robustness for PPV, RSV and flu. That is going to be happening from this winter. I have put on their data as a challenge, just so that can be recognised. But again, part of that assurance comes from the care home tracker. So it's really, really important that you fill that in for us so we can make sure that we know every single care home's had an offer for these vaccinations. Winter vaccination plan to vaccinate in hospital prior to discharge, which I've said that's brand new for this winter. And we've just coming to the end of a project around PPV and RSV to increase uptake with several GP practices spread across the county actually for PPV and RSV vaccines. Some of you may have seen a central vaccination team coming in and offering those into your care homes. That central team have worked with 7 GP practices, and so far they do have till Friday this week is the last day of the programme before they move on to winter. They've vaccinated, well, they've given over 1,100 vaccines for PPV and RSV for those 7 GP practices, so they really have made a huge impact. And just a little bit of a crystal ball into the future, there will be a bit of a shingles focus coming in 2026. So watch this space for more shingles vaccines being offered and some of that uptake being scrutinised a little bit more. So contacts and information, these will all be shared with you. These links will all go through to the relevant places. That top one is a link to the MBS booking where your staff can book in for a flu vaccination or COVID if they're eligible. And then there's my email address and the IMS email address, which is a generic one, which is monitored every day as well. There is a link there to our Lincolnshire Grab a Jab page, which has all of the information around vaccinations that you could possibly think of. And then there's just some more information if you wanted to look a bit further than Lincolnshire around vaccine immunisations that I just wanted to share with you as well. So hopefully you'll agree I've given you a bit of an overview of the benefits of care home staff and residents, talked about the process of implementing a vaccination programme across our care homes in Lincolnshire, spoken about what's required by care home staff, and shared with you some key contacts and resources. And I would appreciate if those of you on the call would just pop one thing in the chat that you've either learned or taken away from today's session. That's just for my learning, really. It's not a test, so I can see how effective I've been in talking to you. I would really, really appreciate that. And thank you. And any questions? I'm going to stop sharing my big screen.
Thank you so much, Kerrie.
You're welcome.
That was
thank you, Kerrie. That was brilliant.
Really, really great. It's a really thorough run through. Are there any questions from? Nothing's come through the chat at the moment, Kerrie. Any questions from our care home colleagues, please? Nothing coming through at the moment, Kerrie.
No, it's fine.
I think somebody that doesn't work in a care home, and but I think from having family members who are in care homes, as that family member, I think what you've described is really structured, is really clear, and I think that was really, really helpful. We said that at the beginning that our Linker colleagues will disseminate and push all of this out. And with your permission, Kerrie, I wondered if I could also share those slides with EHCH colleagues as well through the community practice that I chaired. I think that would be really helpful.
Yeah, absolutely.
Charlotte's commenting here, really interesting and clear. Thank you. It was really interesting and really clear. So
I've made loads of notes to take to training sessions with me to push it, and I've seen in the corner of my eye, I've seen Sean scrolling away and making notes, and he's another one that goes out to a lot of the care homes, so we'll certainly do what we can from Linker.
Yeah, absolutely. And I think we've got a bit of a great alliance now going on, and I'm around, you know, if you've got any questions or people ask you questions they're not sure of, can't get on the booking system, anything, just drop me a shout. I'm usually on Teams. I don't have a mobile phone anymore, but I'm on Teams, or you can drop me an email.
Yeah, thank you so much, Kerrie. Thank you.
You're very welcome.
So and thank you for your time. Well, nothing's come through. People just giving a lot of support for your time and the detail you provided today. Okay, I think unless there are any other queries or questions raised, then we'll look to close. Thanks again, Kerrie, and we'll continue to share that out with our networks.